Welcome back. I'm glad you're here. When your loved one is diagnosed with dementia, that isn't the end of the story for them or you. It's important that you find out what kind they have because they all have unique characteristics. So today I want to talk to you about vascular dementia. Okay, so vascular dementia. What is it? Well, vascular dementia happens when there is a problem with blood supply to parts of the brain. And since those areas in the brain aren't getting enough oxygen and nutrients from the blood, then they become damaged. Unlike in Alzheimer's disease, where the symptoms gradually develop over time, vascular dementia can come on quite suddenly, especially if your loved one had a stroke, because those strokes are going to happen when a blood vessel either blocks an artery and stops the blood from flowing, or basically explodes and causes damage to that area of the brain. Today I want to go over some common trademarks of vascular dementia so that you can better identify if your loved one has this type. First, is the onset new? So did your loved one start showing signs of a mental decline all of a sudden, like after a stroke? If so, then there is a good chance that this is vascular in nature. But that doesn't mean that vascular dementia can't come on gradually. It just means that if it does come on suddenly, then that symptom can help to differentiate it from other types. So if it is vascular dementia, you're going to notice some changes in your loved one, like problems with planning and organizing information. You're going to notice that they have difficulty making decisions, and this could be decisions about what kind of clothes to wear to more serious household financial decisions. You're going to notice that they have trouble following directions, especially if the directions are more complex, like following a recipe or putting something together. They may have trouble concentrating, and you might also notice changes in their behavior or their personality. And then, of course, there's going to be memory issues, but these issues may look a little bit different than the short-term memory issues that you see in Alzheimer's disease. Second, you want to look at duration. So does your loved one's symptoms come and stay or come and go? With vascular dementia, you have to look at other health conditions like diabetes and high blood pressure, because these over time can gradually damage the blood vessels and reduce the supply of blood getting to the brain. So this can be on top of your loved one already having a stroke. So this is why you're going to see changes in their thinking and behavior, not just day to day, but hour to hour, depending on how well the supply of blood is getting to the area. So if your loved one if their blood sugar is really high, then you might notice that their cognition has declined from earlier in the day, maybe when their blood sugar was more stable. Another characteristic of vascular dementia is what's known as the stair-step decline. So this talks about how symptoms happen. So usually you're going to see a sudden decline, and then the symptoms are going to remain stable for a time before declining again a little bit more rapidly and then remaining stable. Now this is different than Alzheimer's, where the decline is more gradual, like a slide. Next, check on their orientation responses. Do they know where they are or what time period they are in? If your loved one has vascular dementia, then their answers are usually going to be very inconsistent and unpredictable 1 minute to the next. So they may know exactly what's going on, and then 5 minutes later you find them coming out of their room and they're looking for their childhood dog. Okay, and then maybe 5 minutes later they go back to knowing exactly what's going on. You also want to check your loved one's ability to know where something is in relation to themselves. So do they know where objects are to the left and to the right of them, or front and back, up and down? Because research has shown that this type of orientation is going to be worse in those with vascular dementia. The last thing that you want to look at is their mood and affect. If your loved one has vascular dementia, then you may notice big shifts in their mood and in their personality. So your loved one may be very big and exaggerated 1 minute. Maybe they're laughing uncontrollably or crying about something. And then perhaps they have a very flat affect the next. So the flat affect, or the flatness, is known as apathy. And this is a really common condition in people that have vascular dementia. And it's different than depression. Apathy is basically your loved one having a condition where they can't care, okay? So they can't care about anything. They can't care about their body. They can't care about going to the bathroom. They can't care about getting dressed. They can't care about going to the doctor. And this is happening because the part of their brain that allows them to care, that allows them to want to do, isn't working. So the drive that they once used to have to get these things done or to take care of themselves, it's gone. And so that's why I'm purposefully using the word can't instead of don't. Don't usually refers to people that have some depression going on, but that's not what this is. So it's important to understand that because an antidepressant is not going to touch it. It's different chemistry. Okay, so now that you know some key things to look for in your loved one, is there anything you can do to help your loved one? Well, yes, in fact. There isn't a cure, of course, but you can help your loved one take steps to keep their heart healthy. So you want to make sure that they have a healthy blood pressure. You want to make sure if they have diabetes that it's checked regularly and kept in control. Also, check and make sure that their cholesterol levels stay okay. If they smoke, try to have them quit. And then, of course, you always want to make sure that you include exercise as a daily practice. Now, what about Lewy body dementia? You will also need to learn more about that one. I'll meet you in this next video. Thanks for watching. I'll be back again soon to help you continue cracking the code.